Welcome back, everybody. About 20 minutes to the top of the hour, and I have a health headline that I think you're going to want to hear this morning. So every year, 1 million people in the United States receive chemotherapy, and this critical treatment causes patients to spend hours in treatment centers, hospitals hooked up to an IV. But could this be done from the comforts of your own home instead? Well, a new study from the Mayo Clinic says yes, and that it could even reduce the physical, emotional, and financial burden of cancer treatment. For more, I'm now joined by Dr. Thomas Marron, who is a medical oncologist. Doctor, thank you for your time this morning. It's always good to see you. You know, I think anybody hears this headline, especially cancer patients and their families, and say, if I could just do this from home, what a relief that would be. As an oncologist, are you on board with this idea?
Yeah, definitely on board. We want to keep our patients from having to come in and see us and, spending the final years of their life, too much of their time is spent with us and not with their family. I think ever since COVID, we've really seen this shift towards doing as much as we can at home or not on the center, in the center at the hospital. And, increasingly we're doing video visits. We're able to do home phlebotomy where we can do blood draws at home. And so I think as we move to doing more at home, if we can shift and do our, safest therapies at home, as opposed to forcing patients to come in and spend hours getting IV infusions, it could be a huge game changer.
Yeah, and driving for some people hours on end to the hospital, being around other people, other sick patients. Did they find that the results were the same as chemo being administered in a hospital setting?
Yeah, this is a small study, but it sort of is the first part of a much larger study here in the US. And similar studies in Europe have shown that the majority of drugs that we give can be given safely at home. There's some drugs, especially in the lung cancer world where I work, where we will never be able to give them at home because, there's a high risk of infusion reactions, allergic reactions to these drugs. But the majority of our drugs, we can give them very safely at home. A lot of them, especially the majority that were given in this study, are being given for gastrointestinal cancers. And these are very cumbersome treatments where patients oftentimes will have to come in, get hooked up to a pump. They head home with that pump, typically in a fanny pack, and then they have to come back 2 days later to get disconnected. And they do this every 2 weeks. And so this could be a huge game changer for those patients who are spending way too much time with us.
And so actually, what does that look like in practice? If I'm giving, if I'm doing chemo at home, am I giving myself chemo? Is there a nurse that has come to the home to make that happen? What does that actually look like?
So right now, in the context of this study, basically somebody comes to your house to draw blood a few days before. We get the results, you do a video visit with your doctor, and then a nurse comes and hooks you up to an IV and does the administration at home. And, there's only certain medicines that they can do this safely with right now, but many of the medicines that we're giving, especially immunotherapies, we now have formulations in the last year that we can give them as injectables instead of IV. So I'm hopeful that within the next 5 to 10 years, we don't even need a nurse to come and visit, and people can self-administer these the way that they're, self-administering Ozempic and insulin.
Yeah, wouldn't that be something? Lastly, the other, I think, critical question I need to ask you before I let you go. My second thought, when I saw this headline, first, of course, was, how great would this be? But second, how cost prohibitive is this? For a care team to bring the medicine, the equipment to your home. Is this going to be feasible for most cancer patients, you think?
It's a very valid question. I think one of the biggest issues, though, is that we don't really have enough doctors or space in our cancer centers to treat a lot of our patients right now. So that's sort of the other side of the spectrum where we really don't have the resources, especially as our population is aging. So we are going to have to invest in training more nurses that are capable of administering these drugs. So we're going to have to wait and see how that pans out and, what the payer situation is as far as insurance companies as well.
Yeah, I'll be fascinated to see. But again, to your point, this was a small pilot study. 10 people were tested. We'll wait to see what a full-on clinical trial has in store. Dr. Thomas Marron, thank you as always for your time and expertise. Appreciate it, sir.
Thank you, Markie.
See you again soon.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.